Hello and welcome everybody to this live video. I'm Matt from 5Doc Physiotherapy and Sports Injury Centre. Now this is the second segment in our live series. If you are watching, just give us a little bit of a wave or like or comment below so that we know that you are there. So today we've got a pretty interesting kind of case that we're discussing, and I think it's a question that people will ask all the time out there. Hello, I can't actually read half of the Instagram name, so we are live on Instagram and Facebook today, which is awesome. I managed to work out the tech well enough. But I have a question from one of my patients, Katie, who says, why does my back ache at the end of the day? Now, I think this is a reasonable kind of question, and it's something that I think a lot of people experience, and it's one of those things that a lot of people don't really know what's going on and why. And I think there's so many different things that can contribute to this. And so we'll deep dive into all these. Now, Katie's a nurse, so I guess, that's a very, very common complaint that we'll see in the nursing population, is that they will find that they do go home with a sore back. I know we get lots of construction workers who are also experiencing very, very similar complaints. To be honest, as a physio, it's often something that may occur as well. Now, there are lots of contributing factors, and obviously we can't deep dive into specific pathology too much because everybody's circumstances are different. But I guess one of the first things that we talk about is muscle activation, and I guess how much muscle endurance you have or how much strength that you have to cope with the demands of your daily life. Now, if you are watching, please press like and comment for us. Now, we know that we've got some muscles in our bottom known as our gluteus medius muscles. Sorry, you can't quite see me there on Facebook. Now, their job, particularly when we're standing on one leg, is to keep our pelvis nice and square. If this gluteus medius muscle isn't working so well, we'll often drop our pelvis or hitch up. Now, this is a really, really important piece of the puzzle for a lot of people that spend their time with significant amounts of their day on their feet. If this muscle's not activating, and to be perfectly honest, we see this in a lot of patients across a broad range of different pathologies that they present with, whether it's a knee problem or an ankle problem or a back problem or a hip issue. We sometimes see glute med, issues and stability issues with people with shoulder issues as well. It's not uncommon. So if those muscles aren't able to keep your pelvis, like I just did, nice and square, well, you're going to be putting some undue stress through your back with every single step that you take. And if we're walking and our pelvis is rocking excessively and we're not able to stabilize ourselves, well, we can start to jam up the little joints in our back. Now, if we can see that hopefully on Facebook as well. If our pelvis is rocking around more than it should, then that force is getting transferred up into our back, and it's putting stress through these things called your zygapophyseal or your facet joints. And that's certainly a very, very big contributor for people suffering with back pain, particularly as the day goes on. So, sometimes these muscles do activate and they actually are quite strong to start off with. But then, as we go around and we do our, 10,000 steps or whatever it is, they fatigue. Now, this is something that we typically call load management. Now, if your muscles don't have the capacity to cope with the demands that you're placing on them, and this might be, something for Katie to think about specifically. She's on her feet. She's a nurse. She's walking around. This is something for the physios to think about. They're often going from patient to patient. Those muscles are being worked. if these muscles are being worked more than your body can handle, well, we're going to have to compensate and cheat somewhat and use some other muscles to help get by. This can place certainly some undue stress onto our backs, and by the time you get home and these muscles are all fatigued and we've started to compensate and cheat and jam up our back somewhat, you betcha you're going home with an aching back. So that's one of the things that we'll typically find, and that's one of the big reasons is this muscle imbalance that we'll have. Now that might also happen with our core muscles, and sometimes our posture in itself can be a significant aspect of getting an aching back. So some people aren't on their feet. They're actually sitting at a desk like I am now. Now, if you're sitting there and you're somewhat slumped, and we don't have to stand up for the Facebook or to see it, but I'm slumped and I'm putting extra stress on these joints by sitting on the back of my pelvis rather than on my nice sit bones here. Well, I'm also going to be putting a lot of extra stress through these joints and through these discs. Now, if you're sitting behind a desk all day and you're doing that for 8 hours or something, well, let me tell you, you're probably getting a sore back too. And come the end of the day, it's quite achy. So posture can be a huge influence over why we get lower back pain and why that lower back pain accumulates at the end of the day as well. So by simply doing some little adjustments and sitting up a little bit taller, we can help keep all this nice disc hydration through this part of, and we can stop some of these bones from jamming up so much. Another thing that we know is that our discs in our back, they actually have fluid that go in and out of them all day long. If you are watching, please press like or give us a wave or comment below and just say hi. Comment any questions that you might have. So our discs have hydration effectively. They have fluid that go in and out of them all day long. Now, when we go to sleep, they typically are nice and hydrated, and they're kind of like a balloon that's full of air. And as our day goes on, depending on the activities that we do, maybe you're again excessively walking, or you're sitting in a truck and that thing's vibrating along, fluid can seep out. Now, if the more we move and the more we bend, that can help to rehydrate these discs and keep all that nice fluid in there. But if you've done some undue forces through your back and you've stressed it a little bit more, well, that can often mean that throughout the day, seepage can occur and you don't actually have your discs as hydrated come the end of the day. So if your discs aren't quite hydrated at the end of the day, it means that all these joints again get closer together, and again, that can be a bit of a stressor and a contributor to lower back pain or to lower back ache come the end of the day. Now, when you go to sleep, they'll often rehydrate. Like I said, general activity should help keep them nice and hydrated. But really important that we do factor this in when we are considering why our back's aching. Another thing that can potentially cause a backache is inadequate footwear. Now, speaking to probably Katie here again, and a lot of the nurses out there, I've seen a lot of people wearing not the best shoes for jobs where they're on their feet excessively. Again, really important factor in changing the way all that force is going up through your feet, through your knees, and through your hips and into your back. If we don't have nice shock absorption, or if our feet are excessively pronating, and we're not able to absorb that shock properly, well, that can definitely be another factor that's going to increase the stress through your back without getting too biomechanical. Again, if those feet are pronating excessively, well, that can also stop that gluteus medius muscle that we talked about earlier. That can actually kind of make it somewhat more inactive, and can also give you some stress through your knees that you might not want. If you've just joined us, please press like so that we know that you're there. Give us a wave. So I guess there's lots and lots of different factors, and it really does depend on your job or depend on your activity level as to why your back is aching. But just to kind of recap there, we've talked about a few topics. We've talked about the muscles not being able to cope with the demands that you've placed on them. We've talked about the discs themselves having a hydration that occurs where fluid can seep out with excessive use. We've also talked about posture and the contribution that posture can make in jamming up those joints in your back. And then lastly, we've talked about footwear. So there are quite a few things, and I dare say that that's not the exhaustive list. That's certainly a list that's comprehensive, but I'm sure there's a lot more factors that can certainly cope in there. But if you are struggling with back pain, a lot of these things are quite easily assessed, and to be honest, if we can assess it and we can see it, well, then we can probably sort it out as well, and we can devise the right exercises as physiotherapists, and we can provide the right manual therapy so that this undue stress isn't constantly affecting you. Now, hopefully all this information has been super amazing. Again, please comment and please like this little live video. If you do have any questions of the day that you'd like me to answer, or any of my team to answer, I'd love to continue to do this segment on a Friday at midday, and I'd love for you to join me again. Please like this, share this with anyone that you think might be also complaining of an achy back at the end of their day, and hopefully this information can help them too. I'm Matt from 5 Physiotherapy and Sports Injury Centre. Thank you so much for joining me. See you guys.